So, Alex, now, with all that, I understand that there was a preliminary clinical trial that was done. What did you find? What was the results? Any benefits? Any?
Our process is we work with clinicians first. So anytime we release a new program, we have to use it with people within our network to understand, first of all, is the program safe? Is the program facilitating the results that we want to see, and what can we learn through the research? So Sheila worked with me to develop a preliminary clinical trial that we actually conducted on the web. So what we did is we built a short series protocol of inTime, which was a 4-week listening experience, 2 9-minute modules a day, 5 days a week for 4 weeks. Our inclusion criteria for the study were ages 3 through adult that had normal binaural hearing. We reached out to our clinician network internationally and provided long-term clinicians working with the programs that were very experienced the opportunity to bring 3 to 4 clients into the study with a requirement that they participated in the study as well, so that they also had that experience. So we had 98 people enroll in the study. 58 have completed the study thus far. These are individuals aged 3 to 90 with varying diagnosis ranging from dementia and Alzheimer's, autism and cerebral palsy, to attention deficit disorders and learning disabilities, to people with anxiety and stress disorders, and normal healthy adults and children. And the response has been really profound. 4 weeks is at a minimum 25% of the recommended protocol. And the things we were looking for, we saw. We saw responses in fine and gross motor skills. We saw responses in communication and engagement, but there was a big surprise. And that's what was happening with people with depression symptoms, anxiety symptoms, and stress-related disorders. And the overarching theme that we saw was that people were becoming more self-regulated, and in fact had formed a need to experience this music and engage with the music that we didn't anticipate. So we've had some very profound life shifts that have come through the study that were really unexpected.
Yeah, but perhaps not so surprising. We know that rhythm has great impact on neurotransmitter dopamine.
Yes.
And that's one of the mechanisms perhaps behind this type of finding.
And it's important to add, not everyone responded positively. Nothing's ever 100%, So we had one child that found the music too strong for him. So he described it hurt and it felt uncomfortable, so he could discontinue the trial. 2 of our Alzheimer's patients only knew classical music, and they were aging, and they were not comfortable with this musical style, so they dropped out of the trial. But that was only 3. So we had no other adverse response reported in the findings, which is unusual with a study with a size of 58 completed, 98 enrolled.
Yeah, so we look forward to the follow-up of that. Yes.
As you were mentioning the whole thing with dopamine, it just occurred to me that it is interesting to think about the fact that we had so many participants in the trial who were really upset that the trial was over. Yeah. That was probably the biggest surprise of everything. It's the summertime, people are doing this trial, and the 4 weeks came to an end, and many of them were really upset that it was over. They wanted it to continue. We were getting calls of how could they continue their listening, and I really do believe, we both believe that it was because they felt good. It felt good to listen. It felt good to listen. It satisfied that pleasure drive.